Welcome, everyone. So as you log on, please enter into chat your name, your facility name. The state where you're located would be great also. We will be using the chat. So please log in to the chat function, find the chat button, enter your name, your facility name, the state where you're located, and we'll begin in less than a minute. We'll begin promptly at 12 noon Central Time. Locate the chat button and please enter in chat your name, your facility name, the state where you're located. I do have chat monitors. If you have a question, please drop it into chat also, and we will address that. So welcome, everyone. Please locate the chat and begin chatting now. I have 12 noon. I'm on Central Time, so we will begin. So welcome. Please continue to enter in chat your name, your facility name, and the state where you're located. My name is Nell Griffin. I am a program specialist at Telligent, and I will be your facilitator for this session. Today, we're going to talk about ongoing vigilance. Before we begin, just want to remind you to please connect with us on social media. That's why you're invited to enter in chat. That also is how we'll socialize. I love verbal conversation. So anyone who wants to verbalize, please use the hand icon. Raise your hand and we'll unmute you if you have the audio portion. If not, please feel free to use the chat and type in any questions or comments. But we do want to be social. This is an interactive session. It's just not you listening to me drone on. So please engage with me through the chat function or raise your hand and unmute and share verbally with us. But also Telligent has Facebook, we're LinkedIn, so please connect with us for resources and tools that you can access on your own time. We do have our Telligent website, QIN-QIO Connect. Now, on that website, we have a Vax Hub. This is a page that's all about the vaccinations, resources, tools to help you with that. And we have an infection prevention and control webpage dedicated solely to support your infection prevention and control efforts. So please do use those resources. You will get a copy of all of these slides after we conclude this presentation. So the links are live and they will be something you can use at your when you have time to review them. Copy of the slides will be coming. So those who are just joining, please enter in chat your name, your facility name, and the state where you're located. Also, we have this is for the nursing homes that are on the call. We have our dashboard. Now, in our dashboard, these are assessments that we encourage every nursing home to complete. It helps you with looking at your systems in the areas you might need to focus some improvement on. We have the COVID preparedness assessment, the emergency preparedness, which every nursing home should have an emergency preparedness plan that is reviewed at least annually. Your infection prevention and control training, unplanned transfers, which is something we all struggle with, and then class. That's about your health equity practices, and for nursing homes that really focuses on person-centered care. So you put your CC in, your CMS certification number in, and it tells you which of these assessments are still pending. None of the assessments take more than a couple of minutes. The longest one may be the emergency preparedness assessment because you do need dates for that. But each one of these will take less than a minute, except the EPP that might take you the longest. Strongly encourage you to do that. All of these will be to your benefit to have completed these assessments. Now, today, we're going to talk about ongoing vigilance to decrease the risk of respiratory infection outbreak in any of your facilities. And then we're going to talk about some strategies to remain vigilant as is necessary. So let's talk about how we can do that. This is maintaining our vigilance through everything that we have to deal with. Now, the CDC website, and that's a resource that I'm sure everyone is very familiar with. During the COVID pandemic, and recently, when you logged onto that website, the CDC website, the first thing that you saw was a lot of COVID information. COVID was prevalent, and it was the main focus of everyone for so long. So when you logged onto this website, that's what you saw first, COVID. Now we're out of the pandemic. However, COVID is still very much prevalent. COVID is still very much a focus of everything we do, but you might have to look for it a little bit more on the CDC website. Also, other respiratory infections. We know RSV. We also know that we're launching right now in our flu season, and we know these will be prevalent. So maintaining our vigilance to protect and keep our residents, visitors, and staff safe when they enter our facility is still vital for us. Now, when you go on the website, the CDC website, you might have to look for information about the COVID guidance, and you might have to look for information that you need for infection prevention and control, since it's not first and foremost anymore, but this is still one of your key resources. So when you go onto this website, they are changing it frequently, but it will give you some current information about what's happening now. And that includes our respiratory, any respiratory outbreaks. So those will be, this will change, the landing page will change on the CDC website. However, COVID-19, influenza, RSV, and any other respiratory infection that is floating around will still be on this website. So strongly encourage you to keep this as one of your primary resources, and to maintain your vigilance, check it often, at least weekly at a minimum is what we recommend. And everybody probably has the link to the CDC website, but again, you'll get these slides. So everything I'm speaking about, you'll have a link directly to that webpage. Now, data drives everything we do. And for respiratory illnesses, in order to stay vigilant, you do need to know what the data is. You need to know what's going on. Now, the CDC does have a website, Respiratory Illness Data Channel, and it's updated every Friday. Now, of course, when we created these slides, it was a couple of weeks ago. So at that time, the last update was September 13th, but every Friday it's updated. So if you go to this link, it will have the most current information. Now, it's going to tell you what is prevalent nationwide, but you can also look at it for your specific community. There's a drop-down box where you could select your state, and then down to even the county, and it'll tell you where you are, what's circulating right now as of the date that this was changed, which is Friday, what your risks are, if you're low, high, medium. Now, strongly encourage you, if this is not one of the resources you use, that you start doing. So every Friday, this can help you prepare for the weekend, because we know weekends can be problematic with staffing and other challenges. But this can let you know what you need to prepare for the weekend. And then strongly encourage you to also look at this during your Monday meeting, because this will give you some information to prepare for the week. This in no way changes the fact that your local public health office is your primary resource for what's happening in your community. That remains still a vital resource, your local public health. But this is something else that you can pull up in your morning meetings, especially on Friday and Monday, and see where you are. Just a snapshot of where you are and what the respiratory infections are in your community. Now, it also, this is a nice feature, and again, you'll get these slides, so you'll have these links, but it gives you a predictive model of what you can expect with the COVID-19, influenza, and RSV prediction. Now, this also changes. The experts are looking at what's happening, and they'll change these predictions based on what they see. So it helps you with that preparation, and it helps you remain vigilant and as up to date as you can possibly be, as what might be approaching your facility, what's in your community, what might be coming up for you that you can prepare for. Everything we do requires planning, and we want to remain as current with the data sources as possible so we can plan. This will help you. Now, this is a resource that's predicting what's going to happen with the 2024-2025 respiratory disease outlook. Experts are looking at it, and they do updated. They change as the data indicates the predictions might be changing. Another resource for you. So with this one, currently in the weekly summary on the CDC website, it lets you know at a glance what's high, what's low, what's in the United States nation. There's a drop down box so you can select if you want to look at the nation, you want to look at the United States. Right now, as we expect, flu is at a minimum, RSV is decreasing, COVID-19 is still high. We're still having a lot of positive cases. Now, that won't be a surprise because we know a lot of nursing homes are having outbreaks right now. But the number of ED visits for any of these for COVID is decreasing because we have better understanding. We know how to manage them in-house now. So that is an indication we aren't sending as many out. Get that positive test. We know how to treat them in-house now. So we don't necessarily need to send them out, which is good. We've learned a lot. Flu, of course, we're going to start seeing the increase with the ED visits and an increase with RSV. But because these are something we're still learning about, and we don't have as much RSV in nursing homes as of yet. But with the increase in the ED visits is how we're getting the information to learn how to treat them. Now, we also have a toolkit for nursing homes that I strongly encourage each of you to click on this link and look at this toolkit. Now, this toolkit is built on 3 action steps. It helps you with preparing, responding, and controlling if any respiratory infection. This is how we stay vigilant. So the prepare part, no surprise. There are action steps for each one. We're going to talk to each one, speak to each of these action steps. So for prepare, vaccinate. We know that vaccine is still one of our most important preventive actions we can take. Now, what happens with the vaccine and where we really need to increase our education focus is on residents, staff, and visitors understanding what a vaccine does. I will still hear from so many that, yeah, I got vaccinated and still got the infection. Vaccines will not prevent you from catching the infection. Vaccine is designed to help your body fight the infection if you get the infection. So the myth of when we use the word protection, what it means needs to be clarified. So the myth or the misunderstanding that a vaccine will prevent you from catching an infection is something that we really strongly need to clarify for everyone, that understanding. The other thing about the vaccine, especially the COVID-19 vaccines that fight the SARS-CoV-2 infection, is understanding that like any virus, it mutates. So that's why we have to change the vaccine. We already understand that pretty much about flu. And that's why last season's flu shot would not work for this season because the virus has mutated. Every season, it's a new vaccine because the virus mutates. Same thing with SARS-CoV-2, it mutates. That's why we have to update the vaccine. Now, the fact that SARS-CoV-2 is not seasonal means, yeah, we do update the vaccine more frequently. All of this is part of the education, which is part of the prepare, that we need to make sure all of our staff, residents, and visitors are clear on. So the actions for preparing, yes, vaccinate. We want to make sure we have the resources we need. We want to monitor. Masking is still key, one of the key preventive measures we can do for anything respiratory, and then that educate, ventilation, and then testing and treat. And all of these are explained in the toolkit, but none of those should be new to anyone on this call. And then we respond. So respond is also implementing everything we're preparing for. So now we're in that preventive phase. We want to prevent the spread from residents in healthcare. We're going to test, we're going to treat, we're going to investigate. Now, investigating is a very important piece of this. If you do have an outbreak, you want to really know why. If there was anything you could have improved upon, we're always improving. Now, many of you might have heard of the story of Typhoid Mary. Now, Typhoid Mary, this was back in the early 1900s where typhoid was spreading. And she was given the distinction of being patient zero, not necessarily that she was, but because they were able to investigate her presence. She was a cook and she worked in certain homes, and in these homes is where the outbreak was. So they did the investigation based on that, and that's how they were able to detect her as patient zero for this outbreak. But really, she was only one of many, possibly. But they were able to track her because they could investigate her steps. Same thing with us in nursing homes. We can investigate those steps. So it's very important we do so, but it's not for punishment, it's for improvement. What can we do better next time? That's the reason we do these investigations. And there are steps to help us with that. Every nursing home will do contact tracing, but not every nursing home is doing a root cause analysis. Not every nursing home is doing that deep investigation into their practices to improve them. And that's what you're encouraged to do in response to an outbreak. And of course, Telligent, we're available to help you with any of that. Now, once you respond, you know what's going on. Now we need to control it. This is putting in those measures to prevent the spread, to prevent any additional outbreaks. And that comes from that investigation piece. So these steps, prepare, respond, control, helps us with any respiratory outbreaks for identifying them and then determining what we can do better. So let's collaborate now. Went through that. I know it was quick, but none of that should have necessarily been new to anyone on this call. This is just a reminder to stay vigilant. That's the purpose of this. It's a refresh of what you know. So of the 3 action steps identified in the viral respiratory pathogens toolkit, type the letter in chat of the one that you now realize you need to really focus on improving in your facility. Type an A if it's the prepare step, type a B if it's the response step, or type a C if it's the control step. And Ro, let me know when you see responses in chat.
Okay, now we have Kelly put in an A, C, 2 C's.
So C's might indicate you've had a recent outbreak and we want to control it. Keep going, Ro. Go ahead.
Can we put in a B?
Respond. Yep. Each step, and none of these are wrong answers. Each of them have an area that each of them might have some steps in it that we realize, oh, we really need to focus on improving that. So no wrong answers. Any other responses, Ro?
A lot more C's.
Control. Yeah. And that's our challenge, right? Control is something that we really need to navigate. But you know what? If you go back to step A and look at those prepare steps, it does help with control if you prepare. So look at those prepare steps and they should help you with both the respond and the control. Thank you for participating in that. Now, let's talk about this. Again, reminder of this is all about just staying vigilant. Do what you know to do. Let's make sure that's the whole purpose of this refresh. So preventing transmission for any viral infection in healthcare is not new. It's something we all need to stay very active and very alert to. So let's talk about those steps. So the first one you always want to do, you got to make sure you have the use of that administration. Your administrative leaders are very much involved. And then you have the engineering and there's air quality. That goes back to environmental services. They are so key to this. Is not just your IP, environmental services, the administration, all have a key role in this, and they have to really set the tone. They make sure you have what you need. Then that communication for everybody needs to understand their role in infection prevention, and hand hygiene and cough etiquette, something that people tend to forget. Everybody knows to cover your mouth when you sneeze, right? But still, we'll see people not doing that all the time. Hand hygiene is something that, in any type of respiratory hygiene, period, is something that we struggle with as humans. But that's still something that we all need to help each other remember to practice consistently, right? And then we want to look at that sort control. If you do have any type of symptoms, mask up, make sure you're doing hand hygiene, prepare, because we want to use those appropriate transmission-based precautions if you suspect even that someone might have an infection, right? And then that's how, especially with your healthcare personnel, you want to make sure that you are keeping them informed and that they feel safe to say, okay, I might not, I don't know if I have an infection, but I have this symptom. So that we can reduce the risk of healthcare personnel spreading. So if they're ill, yeah, manage the, make it a comfortable environment for them to share that they might have an illness, because that is a huge preventive step. So now let's talk about those core practices for infection prevention and control. These are applicable at all times for all possible infections, period, but especially when it comes to respiratory. So let's talk about those. So leadership support, leadership sets the tone. You've got to make sure it's a good place where we can do everything we need to do to control infection. Education and training, always. You want to make sure everybody is dealing with accurate, factual information, not social media, not misinformation, because there's a lot of that out there. So the education and training is a vital piece, that they're dealing with the actual true information, and that applies for healthcare workers as well as family. Then that performance monitoring, once you do the training, especially for visitors, staff, and your resident, that once you do the training of what their role is, that they are adhering to that, because they all have a role in infection prevention and control. And that's where you do the monitoring and the feedback. That's something that leadership should absolutely have a pathway for you to complete. Then those standard precautions and transmission-based precautions, and looking at those medical invasive devices, those, because there's a pathway. If you have an opening in the skin, you know there's a pathway. And then the occupational health, that's making sure your staff are comfortable with letting you know if they do have any potential or possible symptoms. Now we're going to look a little bit closely at 5 and 6, the standard precautions. So the core standard precautions, hand hygiene, we struggle with that. So hand hygiene is something every healthcare person knows they should be performing, and every healthcare person will miss sometime. But we need to be auditing on that to make sure that if it says when you take off your gloves, you should perform hand hygiene, they're doing that as a matter of habit, as a matter of standard practice consistently. And that's where audits come into play. You can do the training, but you also need to monitor that they are performing it as they should on the floor. Environmental cleaning, vital, because they are the one who are going, especially with flu season now, since flu season it really begins today effectively. You want to make sure environmental services are doing that cleaning, because now as it gets colder, those viruses can live on these surfaces longer in colder weather. That's why we have these seasons. In colder weather, these viruses can survive outside the human body longer, and that makes them an incubator for anyone coming around. Environmental cleaning and disinfectant, huge. Then your injection and medication safety. Now, we also are talking about, in this case, those needle precautions, as well as how we administer our medication. Want to make sure that's all done according to evidence-based best practices consistently. Again, auditing, doing that risk assessment, and then wearing the effective protective, the PPE, personal protective equipment, is vital to contain and prevent the spread. And then we want to minimize exposure. So if there is something, we want to immediately garb up. We want to immediately put in those precautions to make sure we are minimizing the risk of spread. And then processing those reusable equipment, that's the cleaning and disinfectant. And AccuCheck machines is something that is so often overlooked, but yet it's one of those high transfer possibilities that we should be looking at. So these are core practices that we should do for infection prevention and control, period, no matter what. But especially, we want to remain vigilant when we are dealing with the potential respiratory exposure that we are entering into now, as of when the flu season starts, which is now. COVID's always been around, but now we're also adding the intensity of flu season. And then the sixth one of the infection prevention and control practices is those transmission-based precautions. Now, this is once we know somebody has been confirmed to have an infection, we want to make sure we put the appropriate precautions in place immediately, and that everybody knows what they are. contact droplet, airborne, whichever it is, what PPE they need to do. And this also increases the importance of things like hand hygiene and PPE compliance. So now let's talk about these. So now that we've reviewed the infection prevention and control standard precaution practices, which do you realize you need to promptly reassess now? Assess if they're at your facility. Type in A if it's hand hygiene, B if it's environmental cleaning, C if it's injection and medication safety, D if it's risk and the use of PPE, E if it's to minimize potential exposures, or F, it's a reprocessing of that reusable medical equipment. Now that we've refreshed this, which one do you realize you now need to focus on after this session ends in your facility? And just type the letter. And Ro, let me know what you're seeing.
We have a couple of D's, or 3 D's and a B so far, and an F from Deborah. And now we're at 5 minutes.
Okay. Now, the purpose of this is just to bring you up to remember we need to focus on these. Again, this is about remaining vigilant, right? So based on what we saw right now, what we just talked about, type the letter of the one that now jumps out at you as being a true. Which do you agree with? A, this program must connect to emergency preparedness, QAPI practices, and the facility assessment. B, only the infection prevention is responsible for infection prevention and control. Or C, preventing, identifying, reporting, and investigating are unique to infection prevention and control. Which letter, pulling this all together, do you most agree with for infection prevention and control? Just the letter. What do you see, bro?
We have an A, 2 A's, no 3.
A.
That's the consensus.
And A is exactly what I agree with. B, it is not only the IP who is responsible, and preventing, reporting, and investigating are not unique to only infection prevention and control. They're also part of QAPI. So that we put that in there because we want to leave you with thinking, with system thinking. System thinking is looking at how everything impacts each other. And infection prevention and control touches on everything. It's resident safety, it's your care planning, it's your resident assessment, it's resident rights, it's QAPI, infection prevention and control, touches on so many of your other requirements. So Deming said, and Deming is the father of is the father of quality improvement, I'm sorry. He said, you must not run your organization as a functional hierarchy. You must understand it is a system. And that is what we want to leave you thinking about in your, as you do your vigilance, you want to look at your systems because they're all involved and impacted. So this is for you to just on your own, you'll get these slides, strongly recommend you look at them. We have listed here for you all of the requirements for long-term care, and each link will take you directly to each of the requirements for you to review. Then you and your team can look at the facility assessment. We have a tool to help you with that. Emergency preparedness, strongly encourage you to make sure your emergency preparedness plan is current. We have a tool that helps you assess that. This is the one we talked about in the beginning, and you could click on this and complete your emergency preparedness assessment. QAPI, everyone should be doing QAPI practices. And then right now, today, officially October 1st, we're in flu season. So immunizations are you should be getting your immunizations in place. Now, we have 2 minutes. Any questions in chat or any questions you have about anything we presented? You will get the slides. This was designed to be a snippet to encourage you to remain vigilant. We're providing you with resources to help you in your vigilance. That was the purpose of this.
No questions in chat.
Okay. If you have any questions later, you know how to reach us. But strongly encourage you to review the slides that are intended for you and your team to use at your leisure once you get these. And if you have questions later, you know how to reach me. My name is Nell Griffin. You can reach me at ngriffin@telligent.com. You can also just send a general email to QI Connect at Telligent or directly to the nursing home's email inbox, which is nursinghomeatelligent.com. And one more final check. Any questions in chat, or anyone want to unmute and just share anything you want to share? A teach back of how I know it was quick, but a teach back moment of anything you heard.
Now, Topi has a question. Should we require non-flu vax to wear masks during flu season?
And that's something absolutely you and your team need to look at. I strongly recommend you talk to your medical director about the policy. So you need to look at the policies if you're with a corporation. Look at your policies for how you want to address that. So is that word require? So you want to make sure that you are aligning with whatever your policies state, but source control is vital, especially if they are symptomatic. So you do want to look at your policies for that. Now, hopefully that answers your question. I'm strongly encouraging you to take that back to your team and discuss and come up with an answer to that one. Hopefully that answered your question.
No more questions.
Okay, and if we do have the next quality essentials, and again, these will be, you can register for them. They will be in your slide deck when you receive them. Encourage you to register for all of the upcoming quality essentials sessions. And we want to thank you for your time. Please don't hesitate to reach out if you have any questions. So thank you. And you may disconnect.